You know what keeps me up at night? It's not the technology we're building, it's the responsibility that comes with it. 9 years ago, when Andreas and I founded Corti, the promise of healthcare AI shone bright. But today, as CTO, I see a landscape that deeply concerns me. We could be in the midst of a golden age. Instead, an AI gold rush is flooding the market with well-intended solutions that are failing our healthcare professionals. In ambient scribing alone, there are now over 60 apps to choose from. The promise of AI is to solve some of healthcare's biggest problems, but many apps are inviting new complexities instead. Every part of the healthcare professional's workflow is about to become AI-enabled. If that means lots of new apps, it will simply not work. The difference in complexity between an out-of-the-box, fast-to-build AI and an AI that has been carefully built to solve an expert task is significant. Similar to the difference between a specialty doctor and an intro-level med student, good enough will never be good enough in healthcare. The stakes are simply too high. 75% of healthcare professionals support AI use in practice, but over half say they wouldn't feel confident using the current solutions. Healthcare systems are stuck in what we call pilot paralysis. AI projects are failing to launch, unable to scale beyond trials due to challenges with accuracy, cost, and integrations. The problem? General-purpose models have been quickly implemented to form the backbone of healthcare's AI infrastructure. I believe any school teacher that has seen GPT-4 plagiarize essays will agree to the fact that such essays will be brilliant at reaching the uninspiring level of mediocre. AI offered for specialized tasks today is ironically very unspecialized. General-purpose models are impressive and versatile, but like jack of all trades who know a little bit about everything, they are the masters of nothing. In healthcare, this creates tools that miss critical nuances and make unreliable notes. Tools that are dangerously verbose and fail to integrate into legacy systems. Never designed for the complexities of healthcare, general models have overpromised and underdelivered. Providers are left spending months piloting solutions that don't quite fit. Instead of taking flight, healthcare AI is grounded, unable to move from concept to clinic. This isn't progress. This is AI pilot paralysis. Our foundation models are trained on something we call AI in residency, inspired by the concept of medical residency. Just as medical residents progress through structured levels of responsibility, our models are designed to grow in complexity and reliability, proving themselves capable before handling more high-stakes tasks. They are deeply trained and honed exclusively for the complexities of healthcare, learning from the context of real-life patient interactions, peer-reviewed papers, and medical data. Unlike AI built to beat human doctors on specific exam papers, they have not been developed to lead an index. Instead, they're trained for the tough realities of healthcare, to actually help where healthcare needs it most, to firefight administrative burden and burnout risk plaguing healthcare. Corti's foundation models are built and trained so that every output is tested and validated in the healthcare domain. They're traceable, auditable, and compliant with relevant healthcare regulations. The results speak for themselves. We are 25% more concise than GPT-4, supporting time-poor clinicians with sharper precision. 20% more accurate than GPT-4 in healthcare contexts, as accuracy here is ethics. 35 times faster than GPT-4 because in healthcare, seconds can mean lives. Earlier, Andreas unveiled the first healthcare AI infrastructure of its kind, comprising 3 new models exclusively available to healthcare systems. Solo, a fast model with audio reasoning, creating expert agents handling complex medical terminology in over 10 languages while integrating effortlessly with existing systems. Ensemble, a powerful model focused on exceptional documentation, creating expert agents that turn consultations into action, transforming medical discussions into structured documentation that is 25% more concise and more accurate than general-purpose AI. Symphony merges powerful reasoning with speed. It is a streaming model operating 35 times faster than GPT-4 and provides evidence-based insights during patient consultations, showing true agentic behavior. Here is where it gets exciting. Picture a medical center of excellence. but in AI form. On top of our foundation models, we've built 20 expert models, specialized capabilities that augments each foundation model. Think of them as medical specialists, coding experts, quality control experts, summarization experts, each one purpose-built for healthcare, compliant by design and ready to integrate into existing workflows. I'm now joined by Dr. Lasse Krøgsboll, who is a general surgeon and has worked clinically for 14 years. Luckily for us, he now works on the product team at Corti. Lasse, you've been out there in the real world. Give us some examples.
Yeah, we've been implementing this in a wide variety of settings and use cases. And one example I'll give is from a leading private healthcare provider in several countries that have been using our models for summarization of the clinical visit. And they were able to drastically reduce admin times doing this. And we also achieved a 100% user satisfaction rating. And in my career, I've used a ton of healthcare software, and to be honest, I really didn't like much of it. So I'm really happy that we're able to give users something they actually like. Another use case is outpatient clinics in Sweden that used our model for coding. And coding is a task that is tedious and it's time-consuming, but at the same time, it's really important for billing purposes. And that's a terrible combination if you're a busy clinician trying to treat a lot of patients. So in this case, we were able to increase the quality of the coding and cut in half the time the users spend on creating the codes. A third example is emergency call center services, where a customer in the United States use our model to help the call taker discriminate, is this a true emergency that requires a proper emergency response, or is this not really an emergency and can be safely handled by an online nursing advice service? And we were able to optimize this emergency workflow by freeing up resources, by providing more than a 50% increase in the number of calls we could safely route to the nurses. And if we can do emergency calls, then we can do a lot of things because the stakes are very high in that setting.
Makes a lot of sense. Thank you so much, Lasse. What's remarkable isn't just the performance, it's the flexibility. We're using the same infrastructure across all these use cases, just configured differently for each need. Think about electricity. We don't expect hospitals to generate their own power. They plug into a reliable grid. Similarly, we don't expect every healthcare vendor to build their own AI infrastructure. They should be able to plug into a trusted healthcare-specific AI grid. At Corti, we've built that grid. Our infrastructure is built for healthcare from the ground up, compliant with regulations, ensuring safety and trust. Flexible, supporting multiple specialties, languages, and use cases. Scalable, working across hospitals, clinics, emergency services, and more. Cost-effective, making cutting-edge AI accessible to all. Easy. Easy to trust, easy to integrate, easy to buy, and easy to understand. Let's create a connected, interoperable ecosystem that breaks out of pilot paralysis thanks to a specialized, high-quality infrastructure. One that's elegant in its simplicity, effective in its execution, and most importantly, one that works seamlessly in the everyday moments where it matters the most. The stakes are simply too high to continue with solutions that don't quite fit. It's time for AI to graduate from endless pilots to everyday practice, to move from promise to performance. Together, we can make AI what it should have been all along, an indispensable, invisible ally flowing through healthcare systems, electric, elegant, accessible to every clinician in every clinic, everywhere. Thank you.